Hi, I'm Cindy, and this is Joy and Bella Chica, and we're here today at Stillpoint Studies talking about different essential oil usage and application and dose forms.
This is a big one because of what's going on in the industry, and especially all of the stuff that you'll see on Facebook and social media.
You know, most people feel really comfortable, blending 1, 2, 3% dilutions, topical usage, using creams and oils and body butters and salves and lotions and things like that. But there's a lot happening now in the terms of aromatic medicine.
Yeah, the industry is moving towards using essential oils as medicine. And in order to do that, you really need to be trained at a certain level. So there are categories of aromatherapy. So there's popular aromatherapy, and that would be using essential oils as the massage, diffusing, candles, maybe making a yoga mat spray, things as that.
Cleaning products for your home, healthy home. And then people go on and take further training. There's a lot of certified aromatherapy programs out there, either online or in person, which you can get 200 hours of training, which is a great base and a foundation to spring off from.
Yeah, it really is a springboard. So to be a certified aromatherapist, according to AIA, the Alliance of International Aromatherapy, and NAHA, the National Association of Holistic Aromatherapy, you need 200 hours or more of formal training, and then you're considered a certified aromatherapist.
And most certified aromatherapists can use essential oils, for treating colds and flus and belly aches and things like that.
So casual issues, but it's important that if there are mommies out there and you're using essential oils with your children, you really should consider becoming a certified aromatherapist. If you're not a certified aromatherapist and you want to use oils with your kids, you really need to consult a certified aromatherapist, because a cold is not just a cold, and diarrhea is not just diarrhea.
All the time, you mean, right?
All the time, yeah. And so, and especially there are certain oils that shouldn't be used with children ever. There are certain oils that can be used with children after a certain age, and there are certain oils that are safe for all kids. And to know the difference is quite important.
But we're going to get into some of those safety concerns when we talk about some of those chemical families a little bit later on.
And then after the certified aromatherapist, there's the advanced practitioner. That's what the Alliance of Aromatherapists refer to it as. And that would be 400 hours. And at that point, 400 hours or more, you're an advanced practitioner. And then you'll be able to start different kind of formulation at higher percentages for topical use, maybe some beginning internal usage, very, very basic.
But we really highly recommend either getting some training under your belt, or having some people in your area or your knowledge base that you can consult with who do have at least 200-hour certified training, or even further, at least 400 hours of training to use essential oils in an internal dose form.
Or even in a heavy topical dose form.
Yes, with those higher dilutions.
It's important to know the chemical families and their contraindications and the safety issues. You know, back in the day when we first started using oils, people used orange and lavender and lemon, and just the regular kind of oils, maybe a eucalyptus or two, a frankincense.
That's the casual usage?
And generally, they're safe oils. Eucalyptus, you have to watch out for the oxide content for kids, but otherwise they really are safe oils. Now, it's much different. You know, people are using oils really as medicine, and a lot of people are ingesting oils. A lot of people are turning to essential oils because they are turning away from allopathic medicine. And it's a really good alternative, supportive modality.
You know, sometimes the chemistry, people have this little fear thing going on with chemistry. When we teach about chemistry and essential oils, we really try and make it straightforward and easy to digest and easy to understand, so that it dispels some of the fears and the myths that are out there.
You could ask anyone that's come through our school. Chemistry is fun. It's super, super cool.
It doesn't have to be hard, and it can be easy, but it's a really important thing to know about these chemical families and the chemistry and the safety issues, especially like we're talking about today with using essential oils in different dose forms.
Let's start with the first one, with this topical usage of essential oils. The first thing that you have to consider when using essential oils is what the purpose is and why you're using it.
When we teach, I always start and I always say to the class, what's the purpose that you're making this blend for?
And if you have no answer, then maybe you shouldn't be using oils, because there's really no purpose for you to use the essential oils. So the first thing that you have to consider when you're using oils topically is the dilution. You want to talk about the dilution?
So blending dilutions. You'll hear out there the safe ones, and just as we said before, typically 1%, 2%, 3% dilutions are pretty safe topical dilutions to use on an everyday basis.
And so if you're saying, well, what does that mean? It means this. If you have 1 ounce of carrier oil, and carrier oil is cream, an oil, aloe, that's what a carrier oil is. If you have 1 ounce of carrier oil, 5 to 6 drops of essential oil total is a 1% dilution. So if you just know that, you could do fantastic mathematical equations and get all your other dilutions. So 2% in a 1 ounce would be 10 to 12 drops. 3% in a 1 ounce would be
15 to 18 drops.
15 to 18 drops. And so you would go from there. And if you blend at 1, 2, or 3%, you will really do no harm. And even if you make a mistake with your oils, you really will do no harm because the dilutions are quite low.
Okay, there are some oils though that you have some safety concerns for, and that's where that chemistry comes back into play, and you really need to know that. But typically, they're safe 1, 2, 3% topical dilutions. If you're using those oils like lavender and sweet orange and things like that, you'll be fine.
So that's topical. And then you could move into higher topical dilutions, and that's really where you need your advanced training, because there are times when it's indicated that you will blend at 10%, maybe 20%. A blend that we learned from Kurt Schnabelt is a blend for shingles, and it's a 50% blend of carrier to an essential oil. And for that, you really need to know what you're playing with. You really need to know what's inside those oils.
So, after topical usage, let's talk a little bit about inhalation.
Okay. So inhalation is using, probably most of you are familiar with the Aromatics. Inhalation is breathing in, right? That's inhalation. And inhalation is one of the most powerful applications of using aromatherapy for a couple reasons. One, the olfactory scent, the olfactory channel directly affects the cerebral cortex and the limbic system. It passes right to that, no decoding of the thalamus.
So there's an immediate response. We have, as people, an immediate response when we inhale essential oils or inhale anything, actually.
So just to go over, if you don't know this, the thalamus is the part of the brain that records everything. I refer to the thalamus as a bad concierge. The thalamus is part of the brain that records everything that happens to us. The only sense that bypasses the thalamus is the sense of smell and olfaction. So when we smell something, the neocortex and the limbic system is directly affected, and so the change in our mood and our emotions can be just like this. So inhalation is really one of the most powerful ways that we can use essential oils. When you use an aroma stick and you breathe in, and it's funny though, because an aroma stick is that little inhaler, and so sometimes you'll see people have it and they go this way.
They're very ladylike.
This is not going to do anything going this way. You got to stick in it and go, and then you breathe in. And when you breathe in, two things happen. The essential oil crosses the blood-brain barrier, and also the little droplets of essential oil land on the mucosa of the nose and is absorbed into the bloodstream at 100%. And inhalation, while people think that it's way better to drink the oil, eat the oil, take the oil, it's not true. inhalation can be one of the most healing methods that you could use using essential oils. Want to tell the story?
It's quite powerful, actually. A few years back, there was a YouTube video of a brain surgeon in South America, Central America, one of the countries. I'm not sure exactly which one it was, but he had a patient with brain cancer, and he used essential oils, or the derivatives of certain essential oils, he asked the patient, would you be willing to try this? And the patient said yes. So actually inhalation, as Joy was talking about, the molecules, the essential oil molecules going up through the nasal cavity affected the brain cancer that was being affected, it was treated. And they showed, on the YouTube video, they showed the shrinkage of this brain tumor over time using inhalation of a derivative of an essential oils.
I think it was a derivative of a component. I think it was a derivative of the monoterpene limonene.
Right.
And so do not take this now and contort it into something that it isn't. This is just to show example how inhalation is quite effective.
Quite powerful medicine.
The way that the derivative of limonene was applied, we don't know. We don't know if it was just inhalation. We don't know if it was injected. So if somebody has brain cancer, taking an essential oil like lemon or grapefruit or lime that has a good amount of limonene in it, that is not the answer, because it is not the limonene, it was a derivative of limonene. Okay? Okay, good.
So this really is just to show how aromatherapy and inhalation of essential oils can be quite powerful.
And quite healing.
So there are some other forms, application and dosage forms, besides topical usage and inhalation.
Yes.
With proper training, now we're going to carry on, because we have used, with our training, we have certain people that we have used other dose forms with.
This other method of using essential oils is really quite big now. There's a lot of controversy. That is internal usage of essential oils. So internal usage of essential oils encompasses oral usage, vaginal usage, and rectal usage. And depending upon what condition you're working with, you would choose one of those routes, those methods of applications. But before you could use any of those, you need to be an advanced practitioner.
Or working with an advanced practitioner, having 400 hours or more of training.
Yeah, if you're using oils in that way and you're not a certified or not an advanced practitioner, it would be really, really smart and necessary to find a clinical aromatherapist with extensive training in internal usage. Just because somebody has 400 hours and is calling themselves an advanced practitioner doesn't mean that they have training in internal usage. That really goes above and beyond the advanced practitioner requirements. Then you're really getting into the clinical and into people that have aromatic medicine background. This is a really big issue with mommy bloggers on the internet and what's going around on Facebook. Many people will read blogs, go to sites, and they're deceiving because they're written in such a powerful and authoritative way. You think that the information that you're receiving is true and accurate. And most of the time it isn't. You know, the websites are slick and they look good, and so you read this and you think, oh, this is wonderful, especially because we want to be able to take our power back and heal ourselves, heal our kids, take care of things.
A lot of people are trying to find alternatives to prescription medications. They're looking for complementary medicine, and there are a lot of different avenues when falling under that umbrella of complementary medicine. It's not just internal essential oil usage. And there are a lot of different avenues that we can use, that I personally use actually when I get sick. There are herbs, there are supplements, there's diet and exercise.
There's flower essences.
There are a lot of different ways. So much you'll see out there says there's an oil for everything, and then it goes one step further about ingesting the oil for everything. So please be aware that there are a lot of cautions around that, and we can't stress more important than we're trying to really get across to you. proper training, advanced training.
And so you say, then what can I use the internet for? Well, you can use the internet, and the internet does have, it's a gigantic library, you know, and the thing is you want to take the right book out. So going to someone's blog, then they're not even certified, have no medical knowledge, have no medical training, this is not a book that you want to take from the library. You want to put that book back on the shelf. And so what kind of book do you want? You want to do some research, go to PubMed, put the botanical name of your oil in and see what comes up so that you could read about it. Definitely get our friend Robert Tisserand's book, Tisserand and Young. That is a fantastic resource. So you could look up the component, you could see if there's contraindications, you could see the safety issues, and at least it's a great starting point. Other ways that you can find true and good information about essential oils is to subscribe to a peer-reviewed journal. So there are two that we subscribe to. One is Laura Cantelli's The International Journal of Holistic Aromatherapy, and we write articles for her sometimes. And the other one is online. It's our friend Rhiannon Harris, The International Journal of Professional Holistic Aromatherapy. And everything in those journals have been peer-reviewed so that it's exactly accurate, true information. Just because somebody publishes a book or just because someone writes a book and is on the shelf doesn't necessarily mean that that information is accurate. So if you're using essential oil as medicine, I would think that you really, really want to know that you're getting accurate, true information.
So let's talk about some of the internal uses of
Okay.
essential oils.
So internal uses. So the first internal use that people are probably familiar with and are doing is oral. And so when you use oils in an oral fashion, there are ways that you should not use them. Let's say it.
You should not be taking drops of essential oil just in your glass of water and drinking them.
Why?
When you put essential oil drops in a glass of water and drink them, you can develop certain gastrointestinal issues. Some ulcerations might happen because we become the fatty substance. Essential oils do not like to just lie on top of water. They like to adhere to fat, and we become the fat substance when we drink them.
So, you know, when we first started training in essential oils, we received very not great training, which ended up being a really wonderful thing, and it served us in a wonderful way. But we were told, kind of like a lot of you out there, that if you take lime and put it in water and then you drink it, you are balancing the pH of your stomach, your gut lining and stuff. And so, you know, now thinking about it, I was like, I mean, I'm a smart lady, right? I'm a smart lady. My dad was a doctor, and that really makes absolutely no sense. But I think I liked the idea of it, so I did. And then I stopped. A friend of mine who was in the class didn't stop. She went to the dentist. The dentist said, what did you do to your teeth? And she said, nothing. So he said, you have no enamel on it. So that drinking of that lime in that water many times during the day, she completely wore the enamel off of her teeth. So
Joy used one essential oil one day because she accidentally used a permanent marker on our whiteboard, our dry erase board.
it was brand new.
It was a brand new board, and she picked up the wrong marker.
And so I heard it squeaking. And then I realized after I wrote the word what I did.
And so she picked up a bottle of lemon essential oil, put a few drops on a paper towel, and it took the permanent marker right off the whiteboard.
So it really does. So if you really think about it, why would you want to be ingesting a drop of oil, any oil, in water? If lemon, which is such a wonderful, uplifting, benign oil,
And it tastes great.
could take off marker.
So the proper way to take oils internally, there are several.
There are several.
Okay, one of the popular ways is with capsules. So you can make a capsule and take essential oils internally with training if it is in a carrier.
So you would take a capsule, you would fill it with olive oil, coconut oil, safflower oil, sesame oil, and then you would put your essential oils in the capsule and you would take it. The thing about that is that if you are using oils in that way, then you're using oils like you're using medicine, like an antibiotic. It's going to be for a certain reason, and it's only going to be for a short time.
Short-term use only.
And all together in the whole day, you cannot ingest more than 9 to 12 drops of essential oil in this total for the day. The other way that you also could take in oils orally is making medicine balls. And that is with some coconut flour and some molasses. And you figure out the amount of milligrams you need, you figure out how many little ballies you're going to make. And then you do that and you make these little medicine balls, and then you could take them as your dosage form. And the last way that we've worked with it is you could get the gummy bears, the gummy vitamins, and they're good, right? Because
they're sweet.
They're just fun, right? I love the gummies. But anyway, you can get the gummy vitamins, and you do the same thing. You figure out how much you want in each one. You do the formulation, you pour it in, and you shake it up, and then you have these little gummies. The reason why you would use a gummy vitamin with essential oil on it would really be for mouth and throat issues.
Right. So sore throats, we use them a lot with people with sore throats. And I do that. If I start to feel that scratchy throat, I'll formulate for myself most of the time. But remember, you need to know how to formulate for this internal usage.
You do. It's just like you need a recipe. You're going to make red sauce. You're not going to be able to make it effectively if you don't know the recipe. And so you really need to know that, in this case, you need to know recipes. You need to know recipes, and you need to follow the recipes exactly if you're going to be using oils like this.
So internal usage, taking essential oils internally, it's based on body weight. So I mean, there's a lot of math and a lot of formulation and a lot of science that goes into it, and knowing the chemistry of the essential oils.
And that would be, that is not just for oral usage, it would be for all of the forms of internal usage.
All of these dose forms, yes.
In fact, if you have a cold, respiratory infection, the most effective way to treat that with an internal usage is through a suppository, because everything that you put in your mouth goes through first pass metabolism of the liver. When you use a suppository, it bypasses the liver. So it bypasses the liver, the essential oils go right into the bloodstream, the exchange happens in the lungs, and so the essential oils can affect the bronchial tubes, and the lungs.
We're going to talk a little bit more about suppositories later.
Yeah.
Yes? Because there's one more internal usage oral dose form, and that's in the liquid syrup. We have made cough syrups in the past, and that is using essential oils in a honey and a water, or a honey and a hydrosol base, and that's also considered an internal oral dose form.
Yeah, and you could even put a little bit of limoncello in it because first of all, it tastes good, and second of all, the oil mixes well with alcohol.
Absolutely. So, you want to talk a little bit more about the rectal suppositories?
So rectal suppositories.
I have some right in front of me.
Oh, let's see them. So these are the suppositories.
These are suppository molds.
These are suppository molds.
Empty, blank.
And
you can buy these online.
And this is suppository.
This is the suppository mold tray, which holds the molds.
And so when you make suppositories, you follow the recipe, and then you will put the liquid.
Once you formulate and you have the recipe done, you just fill these molds, because they're open on the top. You just fill the molds with a pipette, wearing gloves, and then we have a crimper that actually seals these molds so that they're closed, and then they go in the fridge.
And they last quite a long time. And so if you're interested in this, after you get your training or after you're working with your person, you can make a bunch of suppositories and keep them in the refrigerator for when you're not feeling well.
When I was doing my clinical and my advanced training, I had a person that I was working with who had ulcerative colitis. And I used suppositories to help her because she didn't want to be taking steroids and the pharmaceutical drugs. And so we made some suppositories for her, and it really helped her.
And so the way she used the suppositories, and it was just for a limited time.
Short-term use.
It was 4 times a day for 7 days, 1 week on, 1 week off, 1 week on, and now she's feeling much better.
And she's so happy to not have to have had taken those steroids.
So we taught her how to make it, we taught her how to formulate, and so she could make it for herself if she wants to.
But she also has a lot of training, so she knows how to formulate.
She has a lot of training. She went through our program, so she does.
So we once again can't stress enough, proper training, advanced training, 400 hours or more.
And so let's backtrack a little bit to the popular aromatherapy. So if popular aromatherapy is using oils for diffusing, massage, green cleaning, yoga mat spray, room spray, things like that. And so the oils pretty much that you'll be using are from the chemical families monoterpenes, monoterpenols, sesquiterpenes, sesquiterpenols, oxides, and esters. So let's give you, and if you're not familiar with the chemical families, let's give you an example of oil from each of those chemical families. So what is a high monoterpene oil? Go.
Any of the citruses basically would be a high monoterpene oil. Also some of the pines and firs and spruces.
Okay, that monoterpene. And so what would be a high monoterpenol oil? Go.
Sweet marjoram is a monoterpenol, high monoterpenol. Sweet basil is a high monoterpenol rich oil. Palmarosa is a high rosewood.
Palmarosa, Jamarosa, just so you get the feel for it. And so then we'll move on to the sesquiterpenes. And so what's a high sesquiterpene oil? Rich oil?
Virginia cedarwood.
Virginia cedarwood. So the sesquiterpene and sesquiterpenols are the cedarwoods, vetiver, sandalwoods, patchouli, those thick base note oils. And those 4 chemical families really don't have any substantial safety issues, except if a monoterpene essential oil oxidizes, it can become skin irritant and mucous membrane irritant. The other family that's relatively safe is ester.
Are the esters, yes.
Are esters. What's
esters are ester-rich essential oils are like bergamot has a high amount of esters. Roman chamomile is a high ester-rich essential oil.
Lavender has a good deal of esters in it. Helichrysum has a good deal of esters in it. So they, to me, are macaroni and cheese. And I mean, you've heard me say this a million times probably, but they're macaroni and cheese. They're creamy, they're comforting. And so ester-rich oils are just kind of like smooth, like smooth scotch. They're fantastic. And they don't have, they are generally very safe. They really don't have any safety concerns except for birch
and wintergreen.
So birch is methyl salicylate.
That's the ester that's in birch and wintergreen.
And then in a juniper, but not in any of the juniper officinals? No. Juniper communis that you have used, juniper berry, is in juniper. And it's sabinyl acetate, and that is a dangerous ester. But not many essential oil companies carry that.
Esters are a generally safe chemical family to work with.
So there's another chemical family that is pretty safe, and that's the oxide family. And the only oxide that you're really going to come across in using in aromatherapy is 1,8-cineol. And 1,8-cineol is in oils such as eucalyptus,
rosemary,
ravensara,
sarrow.
And so it's generally safe, but it does have 1 or 2 safety concerns.
So we have found that some people who have asthma actually do not do well with essential oils that are high in the chemical component 1,8-cineol. It actually can sometimes cause their bronchial airways to close up. So they have a negative reaction to 1,8-cineol, where most of the time people who do not have asthma, a 1/8 cineol rich essential oil will actually help open up the passage airways and the passageways. It has the opposite effect on some people with asthma.
So how do you know that? So what you do is you take the cap off and you smell it, or you let the person that has asthma smell it. And if they feel that their chest and throat are closing, then you know that that's not an oil that you should use with them. So then you say, well, what can I use with someone that has asthma?
They probably do have that question.
So there are a couple oils that you can use with people that have asthma that give great relief, that don't have that constricting effect.
And that don't have 1/8 cineol in them.
So it's Inula graveolens,
Here's a recipe.
it's Kella, Amnivisnaga, and it's Roman chamomile, Chamomilla nobile. Those 3 oils can be used safely with really anybody, but can be used really safely with asthma people. And although there's not any real scientific documentation in a lab that will show them as being respiratory oils, it's like magic. So the Roman chamomile is antispasmodic. The Inula is like the premier oil for respiratory.
It's this beautiful blue-green essential oil if you haven't experienced before.
And Kella, it doesn't smell that great, but it's wonderful for breathing.
So we had a student who was taking our ACP, and we had just gone out to harvest in the forest that morning. And so it was probably August, and it was hot, and the temperatures were climbing. And then we brought back all the plant material, and we were outside by the still. So it was getting even hotter. Well, we had a student in our class have an asthma attack. We didn't know this. We were outside at the still, all busy, doing our thing, and she disappeared. So I followed her and I went to see what was going on. We also had a nurse in the class at that time, and the nurse was very concerned. She was going to send her to the emergency room. Maybe she should go to urgent care and take care of herself.
I mean, this is the last thing you want to happen when you're teaching an aromatherapy certification program, that your students have to run off to urgent care.
But this was a pretty serious asthma attack that she was having. She was actually starting to cough up some blood. It was bad. And she was in the bathroom, and I said, oh, what are we going to do? So we considered maybe she really should go to urgent care, but in the back of my mind, I thought of this recipe, and I said, I'm going to make her an inhaler. So I quickly got an inhaler and made the exact recipe that Joy talked about with Roman chamomile, Inula, and Kella, and I handed it to her, and I said to myself, oh, gee, I hope it helps. And so she took the inhaler, and within 5 minutes, I heard her coughing subside, and within 10 minutes, completely gone. And I said to myself, this really does work.
And she used the inhaler not through the nasal passages. She used the inhaler
Good point.
through the mouth, like that. So you can use inhalers. You can use the aroma stick that way too. And so when you breathe in through the mouth, you're affecting the lower part of the lungs. When you breathe in through the nose, you're affecting the upper part of the lungs. But it was powerful.
Very powerful. See, it goes back once again that those inhalers and inhalation, whether it's through the nose or the mouth, breathing the essential oil molecules in is quite effective. So there's one other form that we use, internal dosing form that we use. We talked about rectal suppositories. When you make a vaginal suppository, it's actually called a pessary.
And you would use a vaginal suppository for ladies' things, well, obviously. So Candida, yeast
Thrush.
infections, and things. You could even use it for endometriosis and for all things of like the uterus. And I like saying pee-pee. I don't like saying vagina or vaginal. Pee-pee and coolie, that's how I learned it.
There's one other internal dose form that we haven't talked about yet, and those are vaginal suppositories, which are actually called pessaries. We talked a little bit about rectal suppositories before, but vaginal pessaries are a really great dosing form for Candida, vaginal yeast infections,
Endometriosis.
Remember, once again, this is medicine, and you do need proper training in order to formulate these pessaries, suppositories, or any of these internal dose forms.
So I had a massage client actually that had terrible yeast infection. She liked everything natural. So she came over from massage and she was telling me about it, and I mean, it was really quite advanced. So she said that she was using yogurt. I said, I said, there's probably some essential oil formulation that I could help you with. I didn't have the training then, so I called up my friend, and she's a nurse and a clinical aromatherapist, and I asked her for a recipe. And so she said, this is what you can do. And the oils were like thyme geraniol, because it's a soft oil, nerolina, niuli, little tea tree,
Rosalina.
and rosalina. And so those were the oils that she suggested to be put into the vaginal suppository, the pessary, and to be used 4 times a day. But she also said, I need to know what the pathogen is. So she also must take the antibiotics. And I think it's a really, really good example of how the aromatherapy medicine can complement the allopathic medicine when that's absolutely indicated. Aromatherapy is very, very powerful, but it cannot replace antibiotics and deep allopathic strong medicine when there's a deep infection. You need both.
So let's talk a little bit about the chemistry, because we've been stressing the importance of this advanced training. Because we've been talking about the importance of this advanced training, this 400 hours or more training, it's really important to know some of the chemistry and the 10 chemical families, and some of the safety issues and safety concerns and considerations for some of these chemical families.
We spoke about 5 or 6 of them. So the monoterpenes, monoterpenols, sesquiterpenes, sesquiterpenols, oxides, and esters. And generally, those chemical families, or those oils that are high in those chemical families, are generally safe. You really won't hurt yourself or hurt anybody else that you're working with. The other chemical families, this is a different story. You have phenols, ketones, ethers,
aldehydes,
and aldehydes, the last 4. And so we'll go over them in order of safety. So the first one, aldehydes and phenols are about the same. Phenol-rich oils, can you give a couple of them?
A phenol-rich essential oil would be thyme, Thymus vulgaris, chemotype thymol.
And oregano.
Oregano is another one.
Oregano has carvacrol in it.
Ajoan.
So what are some phenol-rich essential oils?
Thyme, thymol, which is Thymus vulgaris, with a chemotype thymol, is a phenol-rich essential oil.
There's oregano.
Oregano.
Oregano has carvacrol in it. And so the phenol oils, they're sharp. And you could tell just by spelling them, they're sharp oils, and they're powerful.
They're highly anti-infectious, and they are used a lot when you're treating for short-term use for an infection.
And they are also very irritating to the mucous membranes, and to the skin. So if you're going to use a phenol-rich oil topically, it's going to be in a way, way low dilution, and only for a short period of time.
Some people call them hot essential oils because of that skin irritating effect. They can cause redness. They're rubefacients.
So the next chemical family is aldehydes. And aldehydes, there are 2 types of aldehydes. There's a lemony aldehyde, so like lemongrass, melissa, which I'm sure that you are aware of and have used. And there's also the other aldehyde, which is a cinnamon aldehyde, and that would be cinnamon bark and cassia. And they're both aldehydes. The cinnamon bark and cassia, they are way, way more mucous membrane irritating than the lemony ones.
But aldehydes can be skin and mucous membrane irritants. Okay, this is for short-term use.
Then the next one up would be ketones. And so these are the serious ketone rich oils would be hyssop, officinalis, mugwort, wormwood, thuja. They all have a ketone called thujone in it. And hyssop has isopenocampone and penocampone. And those components are extremely, I don't want to say dangerous, but I want to say must be used with extreme care.
They can be neurotoxic.
This is a story that happened to a friend of ours. She actually was our trainer, and she had ingested hyssop essential oil under the tongue, maybe 4 or 5 drops. And she
Don't do this, people.
No, don't do it. Don't do it to even see if I'm telling you the truth. Don't do this. And she started having seizures within 15 minutes because it is extremely, extremely neurotoxic.
She had a seizure. They had to call the ambulance. She went to the emergency room, and then she was in the hospital for a week doing a battery of neurological tests to see if she was okay. This is serious safety concerns here.
And nothing, and I mean, she recovered. You know, and this is another case that they couldn't find anything wrong with her. So it's interesting, and she didn't even think to say, I ingested oil, because people think the oils are
benevolent.
And
that they're just plants.
Plant spirit and plant medicine and nature, and this is all true, but they're so concentrated.
They're very powerful, and this is very serious medicine that we're talking about here. This is not for just casual use and just drinking and taking a drop or two under your tongue. You really need to know what you're talking about here.
So there are other essential oils that have ketones in it, and they're not dangerous, and they're
some
fine.
really friendly ketones. So don't be afraid of all ketones.
So vetiver has vetivone, jasmine has jasmone, davana has davanone, helichrysum has etalidione. Those are fine. They have no contraindications. They're not unsafe. They're not neurotoxic. They're not hepatotoxic. They're fine.
But we're still not saying drink them.
No, we're not saying drink them, but you could use them. The other ketone, the thuja or the pineocanphone, you need to know how to use them, and you need advanced training to even use them topically.
What about ethers?
Oh, ethers are my favorite, right? They are my favorite chemical family, and of course they're like the most that have the most safety concerns.
They're quite serious.
Ethers are esters on steroids. They're highly antispasmodic, and they're great. Actually, the reason I think they're one of my favorite chemical families is that ether-rich oils are good for people that have depression, that deal with the emotional, that have challenges in the emotional area of the brain. And I think that's why I like them, because that's my challenge this lifetime. But ether-rich oils, so they're licoricey. So there's tarragon, there's fennel, there's anise, there's exotic basil, star anise.
Well, nutmeg has a little bit of ether component in it, but it doesn't smell licoricey.
No, nutmeg and Palo Santo have a little bit of ether in it, but it's very low.
Very small.
So you could use
percentage.
those. You can use those oils safely. But the licoricey ones, they are very, very, very powerful. They have to be used at low dosage and only topically. You never would ingest an ether-rich oil.
A lot of the oils that Joy's talking about contain a component called estragol.
Transanethol, estragol are two of the big ones.
Those ethers that she mentioned, you would not use them with estrogen-dependent cancers.
No, and you would not use them with, mamas would not use them. Mamas would not use any ether-rich oils, because those oils they cross into the blood, they go into the, if mama's pregnant, it goes into the placenta, and if mama's breastfeeding, it goes into the milk. And so they're genotoxic, they're hepotoxic, they're neurotoxic, they're like the Vicodin plus of essential oils.
And they are estrogenic.
They're estrogenic. So you wouldn't use them with estrogen-related cancers or anyone that has an estrogen concern. And one of the things that's really disturbing is, well, it's funny disturbing. The thing that's disturbing is that these essential oils, they come from pretty much innocuous type of plants, right? So you have star anise. People cook with star anise. My dad drank anisette all the time. Tarragon. People love tarragon. You cook with it all the time. Dill. People love dill seed, dill bagels.
Fennel.
And then there's fennel. And fennel, the fennel, when I was a kid, my mother called it Finocchio.
She's Italian.
Yeah, like Pinocchio. But anyway, fennel is fantastic, but the thing is that the fennel, the herb, I think, is an herb that can help with mamas that are breastfeeding to increase breast production.
Breast milk production.
Breast milk production.
Please, if there was going to make anything breast enhancing.
Well, yeah, that's true. I would get it. So breast milk production. And what was concerning, because on our ethical aromatherapy board, people will write questions, and that was one of the questions. What can I use to naturally increase my breast milk production for my baby? And people were answering fennel. And you can't ingest fennel for that, because fennel has transanethol, and it also has a component called phenchone, which is a ketone, and they pass through the barriers and they pass through the milk. And so you're giving your baby, trying to do the best thing for the baby by breastfeeding, and instead you're breastfeeding compromised milk.
That was a big one that we read a lot on Facebook, social media. It went around like wildfire. And you know how things spread like that on Facebook and on social media. So just be careful and be concerned and be, what's the word? Be a careful consumer and be diligent. Okay, check your sources. Get back to the person who knows that 400-hour clinical training. Hopefully you can find somebody in your community who has that, or maybe you do, or maybe you want to go on for it.
But I tell all of the students, and well, anyone that'll listen to me actually, that if somebody gives you advice on essential oils, the first question that you have to ask is, where did you receive your 200 or 400-hour training? And if they say they went to a weekend Tupperware party for essential oils, or they took a 30-hour course, or even a 24-hour weekend course like we teach, they're not in the position to be giving you any kind of advice on essential oils, especially using the oils as any kind of medicine.
Yes, this whole discussion, this whole topic today is using essential oils and the different dose forms. And I know we've stressed it many times about the proper training, so it's not to put fear out there, but please just know your sources and know who you're working with.
Another issue that we read about and are asked about quite a bit is using essential oils with children, actually babies. And we've heard some terrible,
pretty scary stuff,
horrible stories about different things that have happened with some children using essential oils in an improper way. One story is actually, we taught an aromatherapy class for pregnant mamas and breastfeeding mamas. And one of the mothers that were in the class was putting clove bud on the baby for teething. And fast forward, the kid, growing up, the kid's teeth are coming out, and the kid's teeth had no enamel. The baby teeth came up with no enamel. And so, which is terrible, but it'll be fine because the baby will lose those teeth and will get good, strong teeth.
But she got this advice from someone who she trusted and put this clove bud on the baby's gums before the teeth, as the teeth were coming in, and thought she was doing something great. She thought she was helping the child not have pain, teething pain. And then, as Joy said, fast forward 2 years later, when she brought the child to the dentist said that all these baby teeth they had to go.
So oils in kids, it's a huge topic of discussion in the industry. And basically, you want to be very, very careful if you're using oils with children. And if you're using oils with your kids or with another person's kids, the first thing is you want to make sure that you're buying the highest quality oil that you can. Not adulterated, not old.
Know your source.
Yeah, not oxidized. So you really want to know the source. And so buying oils in a health food store for use in a medicinal way really is not the optimal way because of a couple reasons. You don't know where they came from really, you don't know who the distiller is, and you most certainly don't know when they were distilled. And there is a truth to shelf life. There is a truth to that. It's not that it's all baloney. So you want to know when the oils were distilled and how fresh they are.
Especially if you're going to be using oils in these internal dose forms as medicine, you really want to make sure that you're getting a trusted quality essential oil.
And you would never, ever use oils internally with your kid, and you would never, ever use oils neat on your kid. And you would never use essential oils on babies. There's no reason for it. If your baby is teething, go get baby Oragel. If your baby has a fever or a headache, go get baby Tylenol. There's no reason to be using essential oils in this manner when there are other safe solutions that have been time tested. because then you hurt your kid and then you feel horrible about it.
That being said, we have some hydrosols here that we have, and we're actually going to be making a blend, an internal use blend, using some hydrosols, because hydrosols are a really safe way to use. They're a very dilute form. They come from the steam distillation process, and they do contain microscopic essential oil molecules.
Water soluble.
Water soluble, and it might be something you might consider to use for children.
And yes, hydrosols are great for children, hydrosols are great for pets. And if you're a mom, I would put it on top of the list to go shopping for some hydrosols. We received a call at the shop from a mom who wanted to help a baby with diaper rash. And somebody told her from another company that she should use lavender, thyme, and tea tree neat on the baby.
Essential oils?
Essential oil. Lavender, thyme, and tea tree essential oils on a cotton swab, neat on the baby.
When she changed the baby?
For the baby. For the baby to change the baby. And I said to her, where could you have heard that from? And then she told me. And I was actually quite shocked, honestly, that this would be given out by an essential oil company. So I told her no. And we went to hydrosols. And there are lots of hydrosols that are great for that, for skin things for baby.
Diaper rash?
Yep, there's German chamomile.
Lavender.
Lavender.
Of course.
Yarrow. Roman chamomile. I mean, they're a fantastic fantastic hydrosols that you could use with your kids that are skin healing, skin moisturizing. They'll uplift the baby's mood.
And effective for what you're trying to use them for.
So if you go on the internet and you're scoping around and surfing around and you end up on somebody's page or someone's blog and they are expressing that essential oils are safe for use with children, neat, in a high blend for diaper rash, for teething, get off the blog. Really just get off the blog and either call a company that you trust, find a teacher that you trust, because a good teacher, there's a sacred bond between teacher and student. And so you want to find somebody that you can trust, that will be honest with you and will lead you in the right direction, not somebody that wants to sell oils, not somebody that's going to get a kickback or all of this stuff. You want to find somebody that has a passion for the oils, passion for people, passion for healing, and knows what they're talking about.
So, Bella, we should make a blend now using our hydrosols.
Yeah.
Let's do that.
Yeah.
We're going to start making our mouthwash or breath spray, and you can use it in either way. And today we're going to be using 2 different hydrosols to make our breath spray. The thing about hydrosols is they need to be in sterile conditions. So what I do before I start to use and blend in any of my hydrosol bottles, I always give them a spray with Everclear. It's a 70% Everclear, 30% water dilution. So this bottle has already been sprayed and sanitized. And I do that every single time that I work with hydrosols. So we have in front of us, we have some cinnamon hydrosol and some chocolate mint essential water. These 2 together are going to create this wonderful tasting breath spray. So basically, all you do is you take your hydrosol. This is the cinnamon hydrosol, and this is a 2-ounce spray bottle, and I like to use the glass ones. I keep this in the bathroom, and I like the glass ones best. And so I'm going to fill it 50-50. I'm going to fill it halfway with the cinnamon. And keep in mind, hydrosols, they can be a bit unstable. So you want to make sure that their caps are closed, because it's the oxygen when they get into the hydrosols that has them go off. And when they do go off, they start to grow this kombucha-like little bloom at the bottom, and that's exactly what it's called. It's called a bloom, and they start to bloom, and it looks like kombucha. And that's when you know your hydrosols are no good any longer. So this is the chocolate mint essential water, and I'm just going to fill up the rest of my 2-ounce glass bottle with this chocolate mint essential water. Tighten the cap really well. Put my spray in, and we're good to go. I give it a little shake so that the two different hydrosols are mixed evenly. And you can carry this with you in your purse, you can travel with this, and you can also leave it in your bathroom. There's no worries about leaving this 2-ounce size bottle in your bathroom with it going off. I know a lot of people have questions and concerns about hydrosols, but if you're going to be using this as your breath spray or a mouthwash, and you're going to be using it on a daily basis, you're totally fine. So we're so glad that you've joined us here at Stillpoint Online, and we have a lot of fun creating these classes. So if you have any ideas or you'd like to learn a little bit more about something, just drop us a line, join us on Facebook. We have a great group of individuals that you guys can correspond with, and any questions or thoughts or ideas, just drop us a line.
And we love you guys. So come join us and come join Bella Chica.